Hi everyone, and welcome back to episode 5 of The Power of Dialogue. I am joined today by Ryan and Tom. George, unfortunately, was not able to make it today. There's been a few interesting developments in the news recently, let's just kind of get right into it, talk about the latest COVID-19 updates. Does anyone want to kick us off on that, or? Right. So we apparently not. I think it's been interesting. We have seen definitely. We have been able to observe the effect of the curve flattening. Definitely. We had that very anomalous day a few days ago where we had something like 500 deaths, or it dropped massively, and that has now gone up another disproportionate amount upwards again. So it looks like the government's actually under death certificates have kind of started to try and balance themselves more, kind of spread them around. I think it's probably what we're seeing there.
Right. Yeah, I think it's interesting to see. I think over the past maybe 5 days, there seems to be a bit of a twist in the media towards how we're gonna leave this, kind of based on the idea that things are starting to flatten off now, and we need to be starting to think a little bit more about how we might leave the lockdown.
Yeah. What do you guys think is going to be the way we're going to start leaving it? Like, do you reckon there's going to be a timeline we're going to start opening shops first and then allowing people, or?
The government seems to be setting out a rough, staged approach, seems to be which makes sense that the things that are more important come first, and the government's going to throw pubs under the bus and make them wait absolutely forever before they're allowed to open.
Yeah.
Which may mean that they need more, that tourism and hospitality businesses might need more support in the long run because they might have to stay closed for longer, whereas you're like, I'm trying to think of what were their earlier ones were offices and...
Yeah. Mind you, America's going in almost the completely opposite direction, because I believe in Texas now they're allowing bowling alleys to open and things like that.
Essential.
And Georgia, I believe Georgia is also wanting to lift restrictions.
But because in the US they've got people protesting against these restrictions, I think that just shows that many of the US population has a large percentage of idiots. To be honest, like, it's not like the scientific evidence is in doubt. The stay at home, save lives. Well, we don't have an NHS to save, but
save your money, basically.
Instead of, let's go take our guns and protest outside Capitol buildings that our elected representatives are trying to save our lives. How dare they do such things? I want to go bowling.
To be fair though, bowling is fun. Like, you know, let's not misjudge them. You know, love a bit of bowling.
Bowling is fun. It's order from Amazon a Wii, plug it in, and you don't need to leave your house.
Oh yeah, classic.
Oh, I missed the Wii. That was a good console.
It's massively underrated.
Oh yeah, definitely.
Well, Animal Crossing seems to be the people who are doing well off this must be Nintendo. I've so many
all the game companies actually, and Netflix has literally just announced that they're. I think they've now got highest ever revenue in the first quarter.
I think they've overtaken Disney now in terms of the size of the revenues and stuff.
Yeah.
Although I guess Disney is struggling at the moment.
Yeah, Disney Plus never took over Netflix. I don't think I think they had the first initial sign-ups ever.
Right.
But
I'm not sure.
I think they kind of had growth for a while, and then the curve flattened.
It's quite a phrase.
We love our graphs.
Yeah. I think it's going to be interesting to kind of have an average as well for what the spread's going to look like. Let's ignore America because that's a bit anomalous, but be interesting to kind of see what actually the overall outcome is going to be of all this, and kind of the average trends through how long it lasted.
Internationally, though, in developing countries, was an interesting part of this that we're often we don't see on the news so much, as they're so focused on us and the US and European countries, that some of the restrictions I can't for the life of me remember what country it was in, was struck down by the courts, saying, I think it might have been Malawi, we have 7 ventilators in the country. We haven't got a capacity to try and protect. We're not going to be getting enough anytime soon. More people will die of starvation if markets are shut and they can't work than will die of coronavirus, and that they're completely not.
Yeah.
Because that's the harsh reality that.
Mind you, they also don't travel as far in those countries. We tend to travel a lot more because we have things like train services running frequently and things like, even if you don't have a car, you can still get on a bus or a train and you can get somewhere it's a reasonable distance away pretty quickly.
But there's still, with how infectious this is, yes, that might slow down the spread, but that it will still spread.
It will still spread, yeah.
Especially without any form of social distancing measures, because...
Yeah. Mind you, I remember seeing a few weeks ago, I think there was a almost like a fake news article going around, I think it was in one of the African countries, that African American people of colour couldn't actually get the virus, that it was a purely Western virus, and there were these protests in these countries of literally like hundreds and thousands of people just gathering at one point, just kind of yelling about coronavirus and how it won't affect them.
Which
we know from the videos.
From UK statistics, there are more deaths among BAME communities, a higher proportion than there in the population, which to the point that they're now recording the ethnicity of people who died to try and attempt to look into that.
Yeah.
I think I'm not sure why there is so little focus on the developing world at the moment, and I'm not sure why there's been how they've managed to sort of stay behind things at the moment, but surely at some point that it's going to really hit the poorer countries, and that could be a kind of trigger of a second wave if they're not able to control it, and then it comes back to Europe and the West and Asia again. But I think that's going to be one of the next big things, how we control the spread in poorer places without the health services we've got.
Yeah, probably when we're kind of through our lockdown and the news is actually somewhat news.
Yeah.
I think it will be interesting to see the coronavirus and where it is in the news at that point. Probably still the US.
Yeah. It seems unbelievable the way they're dealing with it over there. Kind of makes us look like we're doing a half-decent job.
I don't think we're doing overly badly in the grand scheme of things. We are doing maybe not as well as other countries, but then one thing I have learned about the British is that we're incredibly stubborn.
Yeah, like some areas we aren't doing well, but at every single point there has been more critical care beds capacity than people needing critical care beds, and the same for ventilators.
Like Spain and Italy,
which, because of the time we had to prepare, that there are just been a huge increase in the number of ICU beds. So some areas we might not be doing as well on an international comparison. I hope they improve, but on a wider scale, it's not terrible.
Yeah, it's not all doom and gloom as the media are trying to put out. I think currently, I think there is definitely there seems to be, to me, a very much of, I think journalists are getting bored, and I think they're trying to just all at the next big scoop, and so they're just kind of trying to twist as many things as possible to actually try and get a story.
Well, the more optimistic thing is they're holding the government to account, therefore they're going to challenge the government on failing. Not what?
Holding the government to account is Parliament's job.
But the media has always also taken on the role of...
It has, but I always feel the media should have more of a place to inform than to pass judgment.
That's a very interesting...
Yeah.
Maybe this should be a future episode, is what I think the media should actually be, because I can talk about that for quite a while.
I'm sure it will be. Japan was another one in terms of not just not implementing it well. That I think the Japan's Prime Minister went and said, we're not going to do widespread testing. It would be a waste of money. And now they've done a U-turn, but with the amount of time until they took the U-turn, means that they're testing very few people.
Yeah.
I think, I haven't been massively into the statistics, but I get the impression that Japan has been slightly behind the ball. I think just with I remember what it must have been maybe 4-6 weeks ago when they were still wanting to have Tokyo 2020 in the summer of the Olympics, and I mean, what is the point in that? You've just got to admit, this is just not going to happen. So it seems to be a little bit dogmatic with it.
Yeah. Also, just want to do pause the episode quickly for a minute there, because we do have someone currently in the live chat posting what I believe is the Declaration of Independence.
Okay, fair play.
It's been going for quite a while now, and he still hasn't finished.
Or is this that you have the legal right to go and protest with your guns outside the state legislatures against measures to save your life?
No, he's just
here we go.
On literally the entire Declaration of Independence.
Sounds like someone you would know, Stephen.
I think it's someone you know.
Is someone I know?
Yeah.
I'm going to get up YouTube on my tablet. Shouldn't we not be shouting them out, essentially, in the middle of an
I'm not shouting them out because I think that, we don't want to support that too much. I'm not going to say the name or anything, but just a bit of fun there that I kind of I saw and entertained.
Well worth pausing the episode for. Yeah. That's
no, I think that it is going to be interesting seeing where the news is going to start taking us when we're out of lockdown. And Europe's starting to get out of lockdown. I'm still suspicious of Germany. I think
Germany has phenomenal numbers, all considering, yeah.
And so I'm not sure. They must not be doing something.
Or maybe it's us.
But it's one thing is in the long term, if there's a second wave, if you did well in controlling the first wave, you still have a population which is hugely susceptible. So it may be a very long time before it's fair to compare. To make direct comparisons between countries, but
I think with Germany they had a few unique advantages in that, from my pretty poor understanding of the German healthcare system, I think it's a slightly more devolved, and I think they have a lot of testing facilities, and so it's been much quicker for them to roll out testing capacity and all the rest of it than it has been for
testing capacity.
Massive. I think it's been hundreds of thousands a day for weeks now.
Yeah. I'm just gonna do a quick search just to double check that.
Yeah.
Go for it. Yeah.
I know for a fact that
I'm not doubting you though, Tom.
No, I'm not sure whether it is that. That could be a bit off the mark.
But it's some of that is just preparedness they already had.
They're doing more than 50,000 a day.
Right.
But they have been for a long time.
Yeah. Well, we're about 20,000 a day currently, aren't we?
Yeah. That.
Once again, I think our capacity is higher, as you said. It's just something's not happening with the capacity.
The daily capacity is roughly 40,000. Dominic Raab just said in Parliament.
Yeah. That's something we have had our first during lockdown COVID-19 Prime Minister's questions. Without
very odd affair, yes.
Which I must confess I wasn't watching. I was prepping for this.
I watched pretty much most of it. I also caught the end of Welsh questions that starts before it, because that comes first before Prime Minister's questions at midday.
But I always find it weird. Scottish briefings are before ours. Scottish press briefings are before ours.
Yeah, well, it makes sense they don't clash them, but yeah, that's just unusual. But yeah, I think generally it's good that there is more scrutiny of the government, and I think Sir Keir Starmer asked lots of good questions, which will hold the government to account, which has been missing for a while since Parliament. The last PMQs was on the 23rd of March, I think.
Yeah.
Wow.
mind you, it is still interesting to me that we haven't had Boris back yet at all. We haven't heard of him since he came out of hospital.
He had a phone call with Trump, and he's going to have another phone call with Queen
Yeah.
at this point. But yeah,
We would have thought, knowing his character by this point, he would have put something out on some form of social media, probably.
He did do like a 6 or 7 minute kind of talk thing from Checkers within a couple of days of him going there, I think. But yeah, since that, there doesn't seem to have been anything.
Yeah, which is weird to me.
But then he uploaded the video before he went into hospital, and it was clear that he wasn't well, and that probably didn't boost public morale. That the government think if they're going to act like a wartime government, then morale might require a bit of propaganda. They haven't been honest with us at every point of his true condition, but some of that isn't out of privacy. It's out of they want to keep people morale high. So until he, as good as he was before, and blustering through making up responses to questions and on the number of children,
I think making up responses to questions there may be a little. Depends if he's making them up he's suggesting he's making them up on the spot, which I'm not quite sure.
Have you seen the video of him answering what his hobby is, where he says it's making buses out of cardboard boxes? It takes about 5 minutes to say it, but it's the most funny thing. That was made up on the spot. You can't believe he prepared. He knows what his own hobby is.
Checkers is now just full of buses.
Yeah.
Do you reckon he's got like 350 million on the side of each of them?
Oh, nice.
Right, we should probably move on because I think there's much more to be talking about here. One extra piece of something we have had in the news recently is the PPE delivery from Turkey that was promised, was delayed, and now only some of it has arrived, I believe.
And despite the government's focus on this, as they are in the daily press briefing, I think the number of gowns, which is the main thing we're a shortage of, is about 3 days worth for the NHS, and that was the entire delivery, and we've got about half of it. So there's not much in terms of what we're using. I don't know why the government keeps on trying to refer to it.
I suppose the question is, though, is we haven't gone out yet.
Well, there are I think gowns is an issue with it in terms of PPE. It seems like what I've heard, like in the stockpiles, they had because they didn't know what type of pandemic they were preparing for. They had lots of gloves, and they've always had large numbers of gloves. But it's fluid repellent gowns. There are quite bad shortages of.
Yeah,
I think the stories from the front line in terms of the lack of the basic stuff, and when people are coming to visit with better PPE than the frontline medical guys have got, I think there's clearly an access issue.
Yeah.
Whether it's a supply issue or or an issue of getting it out to people, I'm not sure.
Yeah. No, there are definitely issues there. I mean, we don't even have our numbers of what our stocks currently are.
Right.
I don't believe.
There's a couple of Publix numbers, but there isn't widespread actual reporting on that. Whereas I know France, I think, does weekly numbers on how much PPE they have used that week and that they have left.
Yeah. Maybe we should take maybe we should take a leaf out of France's book then.
Yeah, more openness would be good so that we can better analyse.
I think that would probably feed the media a bit more as well, because they're kind of.
It would obviously feed the media, but
I'm saying it within a good way, because then they can at least control what they're going to be talking about.
I think Macron has been doing a particularly good job with the public communication side of things over in France. I think there's been a lot of good coverage of what he's been putting out, and I think in contrast to the UK, I do think it would be useful. We do have a statistics issue now. I think with loads of stuff, when there's been a point blank, really straightforward kind of like how many deaths have there been from like care home workers and so on, and it's always it's really complicated to calculate. You can't separate workers from patients and all of this, but it doesn't seem to be like that in a lot of other places. So I think streamlining
I mean, that
the
could
way
well
these are
be due to
calculated could be useful.
that could well be just due to what the bureaucracy of our current system, though, rather than how
It
we're
could
dealing
well
with it.
Of how death
Yeah.
certificates are done regionally by coroners, and it takes ages to compile them.
Yeah.
Yeah,
That's just how it's always been, and it can't. Some
doesn't
countries have
help.
What is
Plus-
interesting, though, if people kind of watching, once again, I'm sure are many thousands of viewers. If people watching are interested, the Office for National Statistics are putting out the daily spreadsheets on how many deaths there are and where they are and all the distributions of them.
Right.
So it's quite interesting comparing it to previous years as well. Just kind of put that out there. So the stats are there, but we just don't have the exact information on the stats, which is what we're lacking, I think.
the breaking down of them to answer more specific questions. We have the total number of deaths in England, the total number of deaths in hospital, and then a lag, and a time lagged figure on the total number of deaths in hospital and the community with confirmed or suspected coronavirus.
Yeah.
There's just quite a time lag on that, which hurts its usefulness for.
Yeah. Mind you, I am seeing quite a few conspiracy theories around about how they're reporting the deaths, and saying because the people aren't tested for it, then they have to put suspected because they can't prove it. And that's actually providing quite a lot of fodder to a lot of these conspiracy theorists. Going, oh look, they could hide, they might be hiding these things. They can also, there could be more deaths actually being reported than that are actually happening due to it. They could just be dying of pneumonia.
But all of the total number of deaths that happened in a week in the UK are publicly reported statistics, and we know it's higher than it would be at this time last year.
Yeah.
By, I think it was 6,000, of which
18,000, I think, by now. Or was it 8,000, I think?
No, I think it was 18,000 extra,
Yeah.
but 10,000 deaths would be expected for this time of year.
Yeah.
And I think around 3,000 of those are suspected or confirmed coronavirus, but the other ones is where the question mark is over. Are they cases where it hasn't been confirmed or suspected at all, or is that people not travelling to A&E out of fear after they are having breathing or chest problems, so actually are dying at home of heart attacks or strokes?
Yeah.
Yeah, it's a conspiracy theory to say I think that the government's doing it on purpose. It's because they don't have enough tests. But that's definitely a actual issue. That
it's definitely an actual issue, but it's the way it's being twisted.
Yeah.
Which I find entertaining. Mind you, I saw an incredibly good COVID-19 conspiracy theory. Like, they literally made like a perfect poster. Like, it was great. Like, the quality of production was amazing on it.
I'm sure you haven't just read the government's posters. You're calling them a conspiracy theory.
I mean, some people would argue that they are. Yeah, I think the PPE delivery. Hopefully, we're going to be seeing more of it. The government have also put out a statement, I believe, saying they are following up all the calls that they're getting about potential PPE deliveries. But there's also loads of scam artists around at the moment who are doing it and saying, I can get you PPE, this much PPE, pay me this much money. And then, of course, the delivery never turns up. So I think they do need to be careful of that.
In PMQs, PMQs without the PM, I think Dominic Raab suggested that as Keir Starmer asked, that some companies were making PPE in the UK to sell to other countries, New had started up to do this, and Dominic Raab suggested that possibly that's because the UK government turned down their PPE because it's not a high enough quality for us. But they're sending it abroad that have different needs and or different standards.
Yeah.
So that's another interesting part of this is over that they don't want sub-quality PPE, which later has to be recalled and destroyed and could lead to more infections amongst healthcare workers.
Yeah. Well, also, as the British I can't remember, it's not the British Medical Journal. British Medical Association have said that some of the equipment can be reused.
I think it was. One of the organisations was changing guidelines. But I think the BMA, which represents doctors, was challenging changes to the guidelines, saying they shouldn't change guidelines based on the availability of supplies. They should change it based on actual scientific need of that equipment.
The thing is, I think what we hear about is them being referred to as disposable gowns. Disposable doesn't necessarily mean one-time use. Obviously, they can wear them for a period of time anyway. They have to wear them for, 6 hours or however long it is. I can't remember the...
Nurses have 12, 13-hour shifts.
That's the one, yeah. But I can't remember if they had to change them in the middle.
Generally not.
That's just the mask, I think. So, if we kind of had a way of cleaning them, whatever form that may take, or even just waiting for the virus to die on them and then using them again. I think we would then. That's not breaking. Disposable just means they can be thrown away rather than one-time uses.
But there's lots of research going on to how best to sterilise them, whether it's with temperature or which is the standard way of sterilising it would destroy most of this equipment, or whether something with acid or whatever.
Or pure ethanol.
But it's whether that is getting a bit desperate to start doing things if we haven't actually tested that works, and then handing it back out to staff to use.
Yeah. I think that the PPE is a big topic, and I don't think that anyone's being 100% clear on it. Right. There's a few extra things we kind of wanted to be talking about today. One of the ones I think that's probably come up in the news a lot recently again is the Cobra meeting that was supposedly there was Cobra meetings that were missed by the Prime Minister, but just before the start of the outbreak.
That's interesting. This is because I think the government playing the ways in normal times chair Cobra meetings, and it can be chaired by any cabinet minister.
Yeah,
is what their response to it is. Whether we think that's fair, but what time period wise we're referring to mid-February roughly, as far as I was aware, or when there were limited numbers, if any, in the UK.
Yeah, I think there were 1 or 2 cases, but that was about it.
But all of those were not community cases. Those were people who returned from Wuhan or China,
or other countries as well. I think by that point.
Yeah, but they weren't. The change in perspective is when people had caught it in the UK. Is when.
Yeah.
Because we had people with Ebola coming back to the UK who had worked in those parts of Africa, but we didn't ever have community transmission of Ebola.
Yeah.
They were all contained in the UK.
I think as well, though, if there's one thing that we've learned through this whole affair, it's that people can attend meetings without actually being in the same room as people. And also, it is. I can't remember what Cobra stands for, but it's Cabinet Office Briefing something.
Yeah, I think it's Briefing Room. I used to think it was Briefing Room 1, but then maybe it's Briefing Room A.
It's COBR. It doesn't have an A.
Yeah, the A doesn't exist.
Cobra as in the snake. Yeah, it's Cabinet Briefing Room.
Right.
Yeah, we just call it Cobra because we like making things sound like snakes.
It makes it secretive and scary when in actual fact it's just they have a meeting with a set list of normal people on.
Yeah.
It includes involved governments, the Mayor of London.
Yeah. I think that I personally think this has kind of been overplayed a lot in the media, too much.
I think that's probably fair. I think with hindsight, it's easy to say this was a crucial time, and the lack of action in that time has been one of the factors which has led to the number of deaths we have today. But I think, sort of thinking back to the time, there was very little cases over here, and it would be very difficult to foresee the level of spread that has occurred since. So I think, generally speaking, with a crisis like this, I would expect the Prime Minister to be there at the centre of things. But obviously, this was not the crisis that it is now a few weeks ago when the meetings were missed.
This would be a good time to refer to the National Risk Register when their view of the main risk was pandemic influenza. But in terms of new viruses, what they seem to be, the likelihood of a new disease like SARS, another type of coronavirus, spreading to the UK is low. But if an outbreak of an emerging infectious disease occurred in the UK and preventative measures were not put in place swiftly, the impact could be seen on the scale of the SARS outbreak in Toronto, which had 251 cases over a period of several months. So I think if that's what you're looking at, you may have to do contact tracing and get in contact with people who have moved from abroad. That's not a global a crisis essentially. Whereas, as they thought, anything on this scale would be influenza, which we've seen before.
Yeah. Well, I think that's exactly the thing about why the coronavirus, or COVID-19 rather, is such an issue, because it's basically the perfect virus for its time. We haven't got anything that actually works on it properly. Like, it's a completely new breed that we haven't come across. And so it's perfectly designed to spread through the population in the way it has.
It's hugely infectious with no known cure, vaccine, or treatment. So that is, sadly, it is likely to spread and cause. However, because we know that we can, through social distancing, save lives, that means why it will cause so much disruption to our way of life is.
Yeah.
So that, I think, is the wider issue of, with hindsight, it's easy to say what we would do differently. If I didn't take history at GCSE, but even in like lower school history at school, you learn about all kinds of things about World War I and World War II, and we're like, well, if we didn't force the Germans to repay reparations, they wouldn't have built up anger. There probably wouldn't have been World War II. We teach like secondary school kids that nowadays, whereas I'm sure the world leaders in 1918 didn't have the foresight to predict a future world war based on their actions.
Yeah, I mean, they did call it the war to end all wars, so they must have found it kind of ironic by the end of it.
Yeah, obviously there is the history of referring to things like the Great War, and then when it happens again, you have to then refer to it as World War One. So that's why this may be wave one of the coronavirus, and that after this lockdown ends, this will be remembered as lockdown 1.
Yeah, I mean, they are saying that it may well be something that we're just going to have to live with as a population.
Or that measures will be turned on and off as it.
I think
I think we're ever going to completely get rid of it. Yeah, sorry, Tom.
Yeah, no, I was just going to say basically the same thing you said, in that I think at the moment everyone is seeing this as an issue which by the end of the summer things will start to return to normal. But I think we're overstating that. I think I was on a call with someone this morning who spent 90 minutes with Gavin Williamson last night, and he said that they're expecting this to be a 12 to 18 months kind of thing in terms of the impact on education, and it's going to be months and months before anything returns vaguely to what has been the norm. And maybe it won't return to norm for a long time. Even if it's just small things like staggered lunches and staggered kind of break times, or maybe classrooms are changed slightly, made a little bit smaller for the foreseeable future, just to minimise the amount of contact.
Yeah, it will be interesting to see how everything in that changes. Which goes on to which we'll be talking about in after our next topic, because that goes into our final topic for today.
Nice.
Just wanted to talk briefly about the return of Parliament. We've already kind of touched on it briefly, and the new layout, how it's all working, seems to be working quite well.
And that they seem to be, the whips had a hard job, as far as I'm aware, of trying to keep MPs away. There was a hard limit of how many could come in on a first come first served basis, and they were told explicitly that they would have no better chance of being called to ask a question if they were in the chamber or participating via Zoom.
Yeah.
You travelled all the way in, and then someone on Zoom just gets picked. That is gutted.
Yeah.
Yeah. I would 100% not go for Zoom, and that's just on a security reason, not.
That is actually an interesting. Is that the House of Lords, like the building next door, has chosen to use Microsoft Teams for their working from home House of Lords sessions, whereas the House of Commons will use Zoom, which seems to be completely nonsensical, as government as far as I'm aware, government ministers may still answer questions in the Lords.
Yeah. And another interesting point, which I find interesting as to why the government chose Zoom. Zoom is a massive security risk. I believe the US Congress, and I think maybe the Senate and other US departments have banned anyone from installing it on their computer if they work for them.
Wow.
But it's a viewing cases out of people getting into the meeting or people of intercepting its contents. As I watched the entirety of the Parliament on TV, it's not secure.
It's more the fact that it's very easy for people to intercept things and also supplant payloads or virus payloads onto it, taking control of those people's computers and accessing whatever they want. Which, when you start talking about government ministers, isn't necessarily what you want to be looking at.
Yeah, within the UK, it has not been approved for. Nothing classified should be discussed on it, and there is set systems for classified discussions.
I mean, I wouldn't even do that, considering we had a scandal recently surrounding it because they started routing data through China.
Yeah, that was quite a bad one. But Zoom has got a terrible history in terms of privacy. When I do get, like, whilst you might not like Microsoft, you've heard of Microsoft, and they have got some history of not being so terrible.
Yeah, we're using Microsoft right now.
Yeah,
to bring this bring this great battle of the minds together. I think that virtual Parliament. I think I won't be surprised if it's actually something that continues on.
Yeah.
Well, it seems to work well for debating and taking questions. That's just what we're doing here. We don't have government experience. Well, Tom does, but I'm not sure about us. But it gets to more harder questions when you get into passing legislation through video call. Because legislation that's not particularly controversial, they could have a couple of MPs to vote for it. As long as they know no one will vote against it, it'll be fine. But
yeah, I mean, it was possible to do things like that though, because Tom and I were on a debate call yesterday on Zoom, and they used you were watching, and they actually could create separate rooms for people to go into, so you could do the eyes on the right, the nasal. It's not going to make any difference.
I mean, the issues with technical problems preventing people from, because like even in that, someone disconnected who was meant to take a question, and they moved to someone who was next in PMQs today. That a probably less technologically smart solution would be that this is handled behind the scenes, and that the government whips, the Labour whips, just simply go to Parliament in person and say how their MPs will vote. That they have told them, not what their party position is, but actually.
I think that would be hard to verify, though. I don't think we'd be able to do that. personally. I think that would be a massive potential breach because
there's already limited proxy voting has been slightly tested, because they used to use pairing where MPs simply agreed not both one on either side wouldn't vote.
yeah,
But now that you vote on proxy, so it essentially would be widespread proxy voting,
yeah,
but done through the couple of people who are in the Commons. How it would work for the tiny parties like Caroline Lucas for the Greens, she doesn't have a whip in Parliament.
I think Caroline Lucas is the Greens nowadays, isn't she?
She's the only Green MP, and she has been for a long time. So yes, but most government policy isn't going to be swung by her vote. To be honest, it's as long as like that. It seems like, or just behind the scenes things that they agree that they send 20 MPs to Parliament to, in the space of 20 minutes, each one by one walk through the chamber, and that counts as passing the law, rather than technical issues that the risk of passing legislation when people don't know what they're voting for, or are voting the wrong way, or people are voting on behalf of other people. Like,
I think there is massive room for technology to really kind of slot in over the next few months, and then when we're well past this coronavirus thing, is I think when I think about the bad things about Parliament, and then look at how it is at the moment, like moving slightly more onto the online side of things, I think the Parliament typically like crazily confrontational, a lot of just rhetoric and the shouting and all this sort of stuff. And I think there's a time and a place for a degree of theatre, but I think it's become a bit of a joke in the past couple of years. And I think online things have become much more specific, much more targeted. There isn't you're not given the sort of the time or the space for all the sort of fancy shouting around and all the rest of it. And I think that's a good thing, and I think it's something that we should utilise more so over the next few months. And I think that a good place for that could be in select committees where it is less official in terms of passing legislation, but at the same time it could be a really good way of maybe having more of them, but making them more meaningful, more specific, more targeted, and maybe opening things up to the public a little bit more in terms of so these things are already public, but in terms of public consultation and bringing in a greater variety of experts who might not be able to make it to Parliament otherwise.
I think on the other side of it as well is we can think about it in as a forefront for global warming and kind of helping on that side of things.
Yeah. I think we do need to become more crisis ready, mentioning the global warming side of things, and I think technology will have a part to play there.
Well, I'm not even thinking that. I'm thinking about people travelling. MPs won't have to travel from wherever they are.
Oh, right.
To
Yeah,
get
exactly.
You know, that means, you know, I can't remember how many people travel down to the Houses of Parliament, but there won't be a commute in that side of it as often.
Yeah, and the cost of it as well.
Yeah, which I believe is that taxpayer that has to pay for petrol?
Probably on expenses.
Yeah, they have. I think they have bursary for travel.
Yeah, I wouldn't mind that. It'd be nice to be able to be paid for petrol.
But
yeah.
Some of some of them representing like northern Scottish constituencies have quite the journey to get down to Parliament on a month. But then not everyone who works in business does that have their job structured around starting late on a Monday and finishing not even having Friday sittings.
Yeah. I don't think there's much more to say about the virtual Parliament, really. I think it's going to work well. I think we're going to have to see if there's any issues with it, as there are bound to be, having, you know, several hundred people connected.
Yeah. There will be teething problems, but I don't envisage it as a permanent. More of an if this is all over and there's a time when we can say this is normal. I think select committees definitely can do more online, but I think actual Parliament will probably continue sitting in person.
Yeah.
Debating in person.
Yeah.
Because sometimes it is good to have the cheer that some actual good policy scrutinising comes from people yelling stuff when they're not meant to.
Yeah.
Which doesn't work. You're muted.
I mean, I will miss Burko in that regard, though. I will always miss John Burko's reactions to some things.
Yeah.
It's an interesting point, because the atmosphere sometimes does shape or give you a good perspective on people's attitude towards stuff. Like, if the Brexit votes were all done in silent, I don't think we would have it. I think Parliament personifies division, and when you can't see that, all of a sudden maybe some of it gets closed over a little bit. Whether that's a good thing or a bad thing is another question, but there is something in the atmosphere kind of conveying a bit more of the wider opinion, which you wouldn't get online. Unless everyone was unmuted, and that'd be a bit of a mess.
I still miss the days back before they had to address the speaker and there would be fights breaking out. I'd quite like to see Johnson fight Starmer.
Where are you referring to? Like the 1400s to 1500s?
No, it's later than
what
that.
time period is your when you want to go back to?
I mean, I'm an old-fashioned person. I like things of the past.
Good old days.
I've got a black belt in karate, so that could be interesting.
Yeah.
When it was a problem with the speakers getting executed when they were sent to tell the king what Parliament had voted to get executed. Why the speakers dragged the chair, because generally people don't want the role.
Yeah.
Good old days.
Yeah.
Done a lot of modernising, so yeah, I think it will continue to do so in future.
Yeah.
Fingers crossed.
Yeah. Unfortunately, we don't have as much time for our last topic as I was hoping, because I do think it might take a while, so we might overrun a bit. I don't know. But talking about kind of our future preparedness for what's going to happen in the future, is it worth? Like we were having a discussion before this regarding things like MI5 and things like that. Would we have to set up, like should we set up a fixed structure that's pure job is to watch out for global pandemics, or would that be a waste of resources? How are we going to be looking forward to predicting what's going to be happening, and then having a hard and fast structure that we can then fall back on? Or is it even worth doing that?
I think there could be room to have something. I think maybe it would be more efficient to have something like something not just for pandemics but for kind of crises generally. Like this could be completely ridiculous, but maybe like a department for risk management or something quite small, but something which is held accountable for the way in which it's preparing for crises and for preparing for risks. I think to have some allocated set resources which don't sort of change over time or are sort of independently given and are not sort of dependent on the sort of things they output and whether that's in the interest of the government or not, but something to really ensure that our kind of preparedness is there. Because I think preparedness is an interesting subject in that it's not something the public wants. Like the public doesn't vote for a government based on how much they're committed to preparing for the next pandemic, because it's not something that affects
It'll be
people's
interesting to see
daily
if that
lives.
does play a role in the next election, though. At least.
Maybe, yeah. It'll be interesting to see how it kind of plays. But yeah, I think there's definitely room for the government to allocate more resources to preparing for this sort of stuff.
I suppose the question is, though, where would our budget for it come from?
I think some of it could come from defence. I think the traditional kind of way of warfare with your big armies and so on seems to be massively decreasing. I think particularly in the Middle East, where war is characterised more by a lot of there's a lot of disorganised kind of groups, but at the same time they're really massively organised in that they're not hierarchical like a traditional Western army is. They're really sort of adaptable, able to change, and that is one of the reasons why they're a real challenge to kind of fight against. But our kind of armies are sort of not built to tackle that sort of threat, and so I think whilst the sort of military threat is changing, and perhaps we are better able to address that kind of threat through allocating resources in a different kind of way, so it's not so expensive. I think at the same time we've got other threats sort of rising and becoming more of an issue than the traditional sort of military threat, terrorist threat, and so on. And so I think resources could be taken from traditional defence over to things like cyber warfare, health, climate change, that sort of stuff.
Yeah.
So whilst Tom's been saying all of that interesting stuff, I mentioned on the show about the Health Protection Agency, which has actually been merged into one you've probably heard of, Public Health England, which has an annual budget of £4.5 billion, whilst both MI5 and MI6 share a budget of £3 billion. So Public Health England, but Public Health England covers a lot of things, including non-communicable diseases and trying to public awareness on smoking and diet, and they have quite a wide range of issues to do with public health that how we're not aware of how much of that is focused on epidemiology and dealing with pandemics.
I mean, could we have a department of epidemiology? But for at least, I think there's going to have to be something set up, especially to look back at this.
A minister directly, as there's a minister for mental health, and there's a minister for there are ministers for smaller parts of departments. If is there a minister within the Department of Health and Social Care responsible for pandemics or pandemic preparation?
I feel like we would have heard more from them if there was.
Yeah, I don't think there is. I will have a look though. Okay,
I think
absolute slander in them.
I think when they see it, I think the likelihood of something, as you guys have mentioned, the likelihood of something on this scale happening in the foreseeable future, I think is pretty low. And so I think in a way to have something permanent and specific towards pandemics could be not necessarily the best allocation of resources, but something which oversees things sort of similar to this nature could be good. I think a typical kind of way of looking at it is planning for common consequences rather than specific risks. So instead of planning for pandemics, plan for the common consequence, which is sort of mass deaths from a sort of uncontrollable, unforeseeable kind of crisis of this nature. Because I think things like obesity is meant to be. I think the World Health Organization have classed that as one of the top 10 risks for the next 50 years. And I think what was the other one? What's it called when you're immune to something? What's it called?
Oh, the superbugs is what they colloquially.
Oh, antibiotic resistance. I think that's it. I think that is the 7th top 10 risk to global health or something. And I think 50% of the world's population will be obese by 2050. And all these sort of things are going to be major challenges more in the immediate kind of future, I think.
Yeah. I mean, and then if another pandemic does come, that's probably going to pose more of a risk to the population.
Exactly, because the more people are obese, the more exposed we are, the lesser our ability of our immune systems to combat this sort of stuff.
Yeah, certainly. I think that it's gonna. I think it's going to be hard without looking back at this event, like on the other side of it, what we should then do looking forward.
Yeah, true.
I think that we're going to have to be able to kind of we will be able to condense all of it down, but as it's still a changing phenomenon, I think it's going to be hard to pin it down. I mean, even if we go, yeah, okay, so we hear about a global pandemic, let's shut all our borders. Even if that's a protocol, but there should be some form of protocols that are almost expected to be followed, as of after the the world is hopefully at least rid of it to some degree. Then kind of look, what did the best people do, what did the worst people do, and I wouldn't surprise me if the UN put out guidance on it. Something like that to protect the world's nations.
But then everyone seems to be like the World Health Organization's advice seems to be quite widely ignored by lots of. That they advise, like, for example, that members of the public shouldn't wear masks, that, like, cloth improvised masks have no benefit, directly against the US advice from the Centre of Disease Control to their entire population.
I believe they have a quarter of the benefit, because I was reading a paper on it the other day. I believe, and even that, and that's only at first. Past a point, they get too full of moisture, and it makes no difference.
that people, and also people, the general public, are probably not wearing them properly or taking them off to scratch their nose and doing stupid stuff that people who are trained to use them probably don't.
Yeah.
But then the World Health Organization early on was like, don't shut your borders. With hindsight, that seems to be an amazingly stupid suggestion. That a response shouldn't be to shut borders. So, yes, I think the World Health on an international level, the World Health Organization may refine its guidance, or countries will just ignore the global organization set up to deal with it.
Yeah, I mean, I'm still, I still think that we should have shut borders a long time ago. Like, when it first came to Europe, I probably would have started thinking about shutting them from certain places. I think that we did put ourselves at. I don't think any country shut its borders that quickly, apart from maybe the US. The US did it quickly, and then look at how they turned out.
I think the US have kind of done like bits and pieces. I think they threatened stuff for a bit and they didn't do anything, and then I think there's been a bit of a mix. So I think very recently, in the past couple of days, maybe even today, they've said they're gonna maybe for the next 30 days or something like that, they're gonna sort out the immigration. I'm sure that is a political decision as much as it is a health decision.
Yeah, that's in the very early stages, but it needs to be very drastic. Trying to limit what countries it's coming from is that there were cases, we know for a fact there were cases long before countries detected them in other countries. That's how it spread internationally.
Yeah.
So that's what you would essentially need to shut borders to everywhere. But then if you let your own citizens back, then that's redundant because your citizens will bring it back.
Yeah. I think there are also, I'm not sure how many issues there would be with this, but just in terms of the flow of goods and all the rest of it, I know you can just shut borders to people, but then people often are what bring goods over the borders, so there could be issues with PPE and testing and all that sort of stuff.
Yeah.
But it seems, whilst the government's not yet saying there will be, it seems like some form of public inquiry is inevitable, is the only way to learn all of these lessons.
Yeah.
Like there was after there is currently ongoing after Grenfell Tower.
Is that still going on?
Yes, I think it's in phase 2. The Conservatives scrapped the second part of the Leveson inquiry, but if we have an inquiry into phone hacking, I think there will be an inquiry into a pandemic.
Yeah.
Which killed many more than phone hacking.
I don't think phone hacking killed many people.
So, because there truly are lessons learned, and the people who are going to do a better job of scrutinising the government isn't going to be the government.
Yeah, mind you, if you look at things like the Spanish flu before, in 1918? Yeah. And then we look now, the way that it's spread is completely different. I know obviously it's a different virus, and the steps taken have been very different.
But some of
so it's going to be interesting to see if that then evolves and it's going to be yet another completely different way because of the way society has moved on.
Some of that's not to do with society, but some of our public health lessons that we're doing now with coronavirus are based on evidence from 100 years ago, as that's the last time is when studies are that's what we know about secondary peaks, is that some in the US states lifted restrictions and then had a secondary peak higher than the original peak.
Yeah.
So that's why countries are taking more cautious approaches than they would have if they didn't have that, which is why the data and statistics is so important to be capturing for future analysis, not even if we're not using them for any reason now.
Yeah. Right. I think we're going to have to call it there for today, unfortunately. I don't think there's kind of much more. I think we've kind of said most things on this. I think hopefully next week we're planning to have at least one guest, maybe 2 guests on as well. And our aim is hopefully to be talking about the defence budget and defence in general, and the war on terror, and maybe we might even get into Trident.
Sounds good.
Try and give us all a bit of a break from COVID-19. We might do a brief sum up at the start and then kind of go on from there. So thank you, both of you, for being here today. Thank you both to our, as we're sure, many hundreds of thousands of viewers.
Especially the one who's obsessed with the US Constitution.
I mean, it's a good thing to be obsessed with. Right. Thank you, and we'll see you all next week.
Cool. See ya.